Mrs. Williams is an 85-year-old woman. She lives in the nursing home, and she just returned from the hospital for an admission for aspiration pneumonia and delirium. I'm going to talk with her daughter, Mrs. Davis, about her wishes for her mom's medical care from this point forward. Hi, Mrs. Davis. It's really good to see you. Thanks so much for coming in to talk with me.
Well, thanks for calling me. I really appreciate it.
As we spoke on the phone, I wanted to talk to you about what your wishes are for your mom's medical care from this point forward, and to talk to you while your mom's health is stable before another acute crisis.
Okay, good.
I wanted to get a sense of your understanding of your mom's condition, dementia, at this point in time and how it's impacting her.
Well, I know she had pneumonia from her food going into her lungs because of her swallowing problems. She's not eating very much now or drinking much at all.
It is important to understand that when folks with dementia are having eating problems, that it is a sign of getting into the advanced stage of the disease. Mm-hmm. I wanted to get a sense from you of what your hopes are for your mom for the remaining time that she has to live.
Well, I really don't want her to be in pain. I want her to be as comfortable as possible. I'd like people to take care of her really well.
What was she like as a person when she was younger?
She was a teacher. She loved to have fun, especially with her family.
In terms of the issue of your mom having difficulty swallowing and also a decreased appetite, it's very common that people ask at this point, can my mom have a feeding tube to help her get nutrition? And I want to go over why we don't recommend for people to have feeding tubes who have dementia. It does not decrease the risk of aspiration pneumonia. It may increase their life expectancy for a few months, but then it's important to think about for what quality of life and what would be acceptable to your mom in terms of way of living at this point. And there are complications with the feeding tube, very common to have infections around the feeding tube site, and you can get ulcerations inside and some bleeding. And the person also not infrequently pulls out the tube because they don't understand why there's this tube in their belly, and we have to send them to the ER when we're not able to put the tube in ourselves in the nursing home.
But I wouldn't want her to starve to death or die of dehydration. That would be awful.
I do understand this is an extremely stressful issue. We love it when our family eats. That makes us feel good. We do know from people that have cancer and are cognitively intact in their final stages of dying, and they report that they're not uncomfortable because they're not eating or drinking. The body has a natural way of adapting and releasing ketones such that they're not suffering. What we do want to do at this time is comfort feeding. We have staff who can spend a lot of time offering her food and giving it to her slowly, making sure it's the right consistency to minimize the risk of aspiration.
All right, as long as she's not suffering, then that helps me.
Yeah.
It's hard.
Did she ever share this with you in terms of what her wishes would be in terms of nutrition, hydration?
No, not directly, but she did have a sister who died. She was really sick, and they ended up putting her on a respirator, and my mother was very upset about that. She didn't think that was right. She thought she should just be allowed to die in peace.
I understand. This is something that I would really support too, that we make sure to focus the goal on keeping her comfortable.
Well, that would be very important. Yeah, that would make me feel a lot better.
I want to summarize what we've gone over here. I think that it's important to understand that this is just one conversation and we can continue to have these conversations. I know these decisions are very stressful and feel burdensome. One thing to help hopefully unburden you is to remind yourself that you're making decisions for what your mom would want. I get the sense from you that you are on board with having the goal of her medical care focus on comfort, and she's not going to be abandoned. We're going to have all palliative or comfort measures given to her.
But what if something like she falls and breaks a bone or something?
I think that it is important for any incident that occurs, anything that comes up, that if it's thought that doing a medical intervention will have her be more comfortable, then we should do it. So if she falls and breaks her hip, then to repair it will be a really important relief for pain. So we would
Right.
want to do that.
Yeah, I mean, I'd like to keep my mother forever, but I understand that she's going, and I think what she would want is to be comfortable. I don't think she wants breathing tubes or feeding tubes or anything like that. She'll want to die peacefully.
And in line with that, we would recommend that if she were to have a heart attack in her sleep or something like this, that we just let her die peacefully and not do resuscitation measures. And I really encourage you to speak to family and share what we spoke about so that they can understand about all this. I'm happy to speak to them as well, as much as needed.
Well, I really appreciate you taking the time to talk to me. It's really been helpful.